I couldn't agree more that having good quality hearing aids is only the start of a journey. And I think it's important to have good hearing care professionals to guide, our patients along the way to have the better outcomes and to have the best outcomes. And I think, it brings another analogy that I have in mind. It's like we're buying a pair of new shoes, right? A pair of new running shoes. We don't just buy a pair of new running shoes and say, hey, you know what? I'm going to keep fit and I'm going to look good. I'm going to lose weight. I'm going to look slim and slender. That's not the case. We actually have to put in the time, the effort, as well as the discipline. And then at the same time to feel motivated and be motivated to actually run with this pair of new running shoes in order to stay fit. Correct? Yeah.
Tell me about exercising and not putting on weight, right? As you get older, it gets so much harder. But I love that analogy of the running shoes, right? You can have the most expensive, the most high-tech running shoes, but if you just look at it and smell it and not exercise with it, you're not going to get the fitness benefit, right? And I think same thing with the hearing aid. You can have the most top of the range, the most expensive hearing aid, but if these hearing aids are sitting in your drawer,
it's not going to work.
Yeah, it's not going to treat your hearing loss. So I think I completely agree. You need to be using the hearing aids.
Yeah. So Dr. Ho, have you encountered any real life experiences on patients whose lives have been transformed after using hearing aids?
Wow. How much time do we have? Let me share this patient. Quite recent. Ladies in her 60s, really sweet lady. And she would always attend with her nephew because she's single.
Mm-hmm.
And quite a sad story because about a year before I saw her, she had a stroke. And even like a year later, she wasn't really functioning that well and was quite dependent on her nephew, right? To bring her everywhere. And even her activities of daily living, she wasn't managing that well. Mm-hmm. And then it was sad because the rehab team have sort of like labeled her as not rehabable, right? Because she wasn't responding to their commands.
Okay.
And the thing was, she has quite severe hearing loss as well. That wasn't recognized.
Okay.
So once we diagnosed that and got her fitted with hearing aids, very quickly, she got back onto her feet and could resume her rehab, and within a short time was functioning pretty independently again.
And then her life is transformed.
Completely. Yeah. And also for the caregiver, the nephew.
Yeah, their lives are transformed as well.
Yes,
right?
yes. So I think it just shows how important it is to diagnose and treat the hearing loss.
And I mean, can you imagine if this patient of yours was not properly fitted with hearing aids, then she might even end up in a nursing home.
That's a great point. I think she was on the verge of being put in a nursing home when she came to see me, and now she's living at home again independently. Yeah. So big cause of not treating the hearing loss. And for this lady is example of the physical side of things. But earlier we talked about the cognition, right?
Yes, that's
dementia.
Right.
And I think you can ask any caregiver, right? The only thing worse about treating a patient with, looking after a patient with dementia is looking after a patient with dementia and hearing loss, right? Yeah. So yes, I think hearing aids, good quality hearing aids do cost. Yeah. But I think we do realize that you do get what you pay for. Quality products do cost. And what's important is that we need to be able to discuss the cost of not treating the hearing loss.
Yeah, it's true. It's absolutely true. And I think, in this fast-paced modern society, we are so used to, quick fixes, immediate solutions, right? And we need to step back and think, hey, look, it's not just about getting good quality hearing aids, but putting the time and effort. It involves getting the right support, guidance from hearing care professionals and audiologists, and then with the buy-in of your support system, that brings about the best outcome and usage of hearing aids.
Yeah, completely agree. I think it's time for a paradigm shift, right? When we talk about the treatment of hearing loss, we have to move beyond just persuading the patient to get hearing aids get the hearing aids fitted. Really what matters is the outcome, right? And the outcome that we all want to see is the successful, long-term, regular usage of hearing aid, and that will solve or prevent the disability and handicap from having untreated hearing loss.